Hi there, just a quick warning to all my regular viewers on this channel. This is an unusual video, so if you just want to see about photography, then please stop the video now and don't. This is a different subject, but I think I need to respond to it. So if you're just wanting to watch about videos on photography, please stop the video now. However, if you would like to hear my response about the ambulance service in the UK to Dr. Suneel Dhand, please keep watching. Hi YouTube, my name is Brian James, and I've just watched a video by a chap by the name of Dr. Suneel Dhand, and I watch a lot of his videos. I think he's a very informed and very informative medical doctor who works out the States, but started off over here in Britain, and I have a lot of respect for what he says. But this is a slight disagreement, I think, for Dr. Dhand, and I mean it in the most respectful manner. He's just done a video, and I'll try and drop I'll put a link to it above, to Dr. Dhand's video. Excellent video, and again informative, but I think it's coming from a slightly wrong angle, if I may. He's talking about the ambulance waiting times in the UK, and he is correct. We have a serious problem on the ambulance waiting times, and I'll not say what my tie is to ambulances, but all I will say is I've got a reasonable amount of informed knowledge, shall we say. And the tone of his video does suggest that the problem lies with the ambulance service, because they're not getting out. There's people having to, wait an hour and a half for a 999 call to be answered, being left on the floor for 20 hours when they've fallen over and things like that before an ambulance turns up. And it sounds as if the ambulance service isn't capable of reacting. I slightly disagree with that. First of all, with the ambulances themselves, most ambulances, if we have free ambulances, if there is a vehicle free, it's dispatched and it's put on a priority. So 999 calls are prioritised, and there is obviously different levels of response for different ailments. But a Category 1 call is given a serious high priority. The problem that we have is we have a limited number of ambulances and crews per area. So if they go out and pick a patient up to take them to the hospital, which is quite often what they have to do, then they'll take them to the hospital, and they'll have to try and hand them over to accident emergency to get them in. The problem is accident emergency is clogged up. So what happens then? The ambulance crew can't release their patient because they don't want to release it too. So they have a responsibility for that patient and keep on looking after them, which means that an ambulance will be sat outside. It's a safe place, it's a medical environment, but they're sat outside with a patient in waiting for quite a considerable amount of time, which takes that ambulance and its crew away from being able to do call-outs. Why can't they be accepted into accident emergency? Because accident emergency sections are flat out. They're chock-a-block. They really are full. So why aren't they getting rid of their patients? Well, their patients, there's no beds on the wards. The hospital systems aren't good enough to have beds on the wards free. Or if they have got beds, they don't have the staff to be able to man them properly. And I'm not going to the whys and wherefores on this, but that's basically what's happening. So if A&E can't move their patients onto the general wards, then they can't make beds for the ambulance to be able to pass their patients on. And a lot of the further care which would release beds from the hospitals has been taken away. Where I live in Cumbria, for instance, we used to have a lot of cottage hospitals which would take a lot of people from the wards and give them further care in remote hospitals. A lot of those have been closed down. So the wards are full, so they can't take the patients from A&E, which is full, and they can't take the patients from the ambulance, which means the ambulance is not able to be dispatched to its next patient because it's already got a patient on board and their crew is taken up with it. So we have two situations. Do we provide something at the end to free the beds up through the system, or do we put more ambulances and crews on the front end, but all that's going to happen is you're going to have a backlog. You're still going to have a blockage at the front end because there's nowhere to clear it to. So that's the first thing. So I think it's a little bit unfair to blame the ambulance services necessarily for that. The second thing with this, of course, is they have a bit of a problem insofar as he mentioned about the ambulance crews going on strike. Now, yes, the ambulance crews are going on strike. I think they've had 2 days strike. And whether you agree or disagree with the strike, I'm not bringing that into question. However, it does make it out somewhat as if this is having a serious impact on the clearance time. And again, I don't believe it is. There are crews who are on strike, but if a serious Category 1 call comes in, I know for a fact they are dropping the strike, the picket, and going onto the ambulance and actually attending. So people who are Category 1 calls, the serious calls, are being attended to by the people who are actually on strike, because they're dropping the strike, they're in their uniform, they're ready, and they're getting the ambulance. The ambulances are prepped and they're taking them out to actually get those people. So those people are getting the care. But the third thing, which is a bit of an issue to me, which wasn't really covered in Dr. Dhand's video, is the difference between what he perceives on the ambulance service in the States and the ambulance service over here. In the States, if you call an ambulance out, you're going to have to pay for the service. So people think twice if it's a minor ailment before they call an ambulance. They will go to other medical routes, because if you call an ambulance out, it can get very, very expensive. And if you don't have the full Medicare, or you have a limited Medicare, you could end up with a big bill. So people will tend to think twice before picking a telephone up and calling 911 in our country, or 999 over here, to get a response. Over here, it's a totally free service. People will call up the ambulances for all sorts of things. They could be calling up for minor little ailments. They could be calling it up because they're drunk. They could be calling it up for all sorts of things. And these things do happen. And every time an ambulance responds to somebody, because they will respond to people who make 999 calls. But if somebody calls up and they know the system, they know what to say to get a higher level response. And the ambulance and crew will be dispatched at high speed, putting their own lives at risk, putting other people's lives at risk by doing a high-speed response. Even though they're highly trained, it's still a high-speed response in the middle of a crowded city, for instance, to go and give aid to somebody who doesn't need it necessarily, who is really undermining the system, in my opinion. These are all my opinions on it, from my observations. So I'm not saying this is gospel, but it's what I certainly have observed with a certain amount of good knowledge. That doesn't happen in the States, or not so much, because people will be charged for it. Over here, it's very easy for somebody just to pick the phone up and shout and scream and cry wolf, basically. So what do you think? As I say, have a watch of Dr. Dhand's videos. I think they are absolutely superb. Now, if you are one of my regular viewers on here, I do appreciate this is a little bit out of the normal, and I am sorry for that, but I just thought it needed said. But do have a look at Dr. Dhand's videos and his channel. I think he really has some fantastic points. He was also a medical doctor over in the UK before he went to the States, and is speaking from a certain amount of authority, which I do respect. But on this particular point, I thought I needed to respond. So hopefully it'll be taken in a positive way, and hopefully it'll give a little bit more informed information for you watching the video out there. And if you are worried about getting an ambulance, a 999 ambulance, then maybe you'll understand why there are some delays. It's not necessarily the ambulance staff or even the ambulance system. It's the system as a whole in the NHS, which could be problematic on this. However, let me know in the comments below, if you would, as to what you think. As I say, thank you very much for bearing with me on this unusual subject from me. But until the next time on the next video, I'll say bye-bye. Thanks. Bye-bye.